name is Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are very excited to have two guests on the podcast. We're thrilled to be joined by Ed Likovich, PhD and CEO and founder of Nymbl Science, as well as Dr. Bob Mirsky, Chief Medical Officer at Nymbl. Nymbl is the #1 scientifically proven fall prevention program for Medicare Advantage members. So, Ed, Dr. Mirsky, welcome.
Great to be here.
Yep, nice to be here.
Absolutely. Really great to have you on. And I'll give both of you a little bit of intro for all of our guests and viewers that aren't as familiar with Nymbl or yourselves. So Ed is CEO of a health tech company called Nymbl Science and is on a personal mission to empower older adults to live more freely through digital balance training. He hails from Hermitage, Pennsylvania, and earned 3 degrees from Harvard, including a PhD in applied physics. His career spans and roles at JP Morgan's algorithmic trading group and his tenure as CEO of Good Luck's Technology, where he pioneered bright light therapy products for depression. So Ed's got a really unique background, spanning from academia to cutting edge digital health solutions and everything in between. Also introducing Dr. Bob Mirsky, Chief Medical Officer at Nymbl. Dr. Mirsky is the president of Resilient Health Outcomes Advisors, and previously he was the VP of Medical Operations and Chief Medical Officer of Medicare at Aetna during the peak of COVID and the pandemic. Previously, Dr. Mirsky was CMO at Coventry Health America. He's got his BA from University of Michigan and an MD from Downstate Health Sciences. He is a seasoned physician executive across Medicare, Medicaid, and commercial lines of business. So welcome. Really excited to have you.
Thank you.
Yeah. So would love to start with Ed. What inspired you to get into healthcare with a degree in physics? How did your degree in physics help you once you joined the healthcare world?
Yeah, good question. So, I started off in the research world. For a long time, I thought I wanted to be an academic. I thought I wanted to be a professor. And then I went to a conference and gave a talk, and there were, 6 people there, and we were talking about something that might be commercialized in 15 years. So, maybe my ego or my vanity is too big, but I needed something that was both more connected to people directly and had a quicker impact. And so I found that in healthcare. My first company, as you mentioned in the intro, was around bright light therapy. And I got a call from a buddy one day, and off to the races we were. And I just found the ability to help people on a daily basis something worth getting up for. So that's my quick story.
Dr. Mirsky, what inspired you to go into healthcare and become a doctor?
Sure. Well, I was a psychology major as an undergraduate at U of M, and felt like I would have a greater impact as a physician. And then it was just a matter of what specialty I would choose. And I chose family medicine because I thought it really embraced the whole person, the medical, the behavioral, and social determinants of health, even though it wasn't called that way back when.
Yeah.
So I practiced for about a decade and just found myself getting on bigger and bigger stages of population health management through taking risk in primary care clinics and then working in various stepwise roles in the health plan space, provider-owned health plans, blue plans, Medicaid, Medicare. And then the last part of my journey was really in the Coventry Aetna CVS world, where, for the last several years, I was the chief medical officer, as you mentioned, of Aetna's Medicare business.
Yeah, and why did you decide to make the transition from practicing doc to healthcare executive?
I think it's like a matter of retail versus wholesale. I really enjoyed and got a lot of satisfaction from helping each individual patient, but discovered over time that I could have an outsized impact on populations. And so, at Aetna Medicare, in the Medicare Advantage business, we we're responsible for over 3 million Medicare members. So the impact that we could have through programmatic types of approaches was compelling. So I really enjoyed that.
Can you share with our listeners your experience as leading, chief medical officer at Aetna, and how that Medicare experience has translated since joining Nymbl?
Yeah, I think earlier in my career, it was about the basic blocking and tackling that a medical director does in terms of sort of managing utilization and so forth. But in the last few years of my experience at Aetna Medicare, it became more about that whole person, sort of going back to my roots. And I realized that there was a lot more, to take on than just the quote medical programs, the clinical programs. And so I found myself very drawn to social determinants of health issues, as well as behavioral health, as well as medical, and realized that that whole package was really intertwined, and you couldn't tease out, one from the other. And so if you wanted to really improve people's lives, you had to get into all those particular areas. So in my post health plan career, now as a consultant, advisor, and chief medical officer for Nymbl, I'm trying to figure out what programs are going to have the greatest impact, not only on avoiding falls, which is kind of, the end product of what we do, but in helping people age and thrive in their homes and communities. And if you're concerned about your balance and your stability and whether you're going to fall in your home or in your community, you start to have your life shrinks. And so I found Nymbl to be a really compelling solution, not only to avoid falls, but to keep people active and mobile in their lives.
It's a great mission. Ed, what inspired you to found Nymbl Science?
Yeah, it's actually a bit of a sad story. It was my grandfather who passed away as the result of a fall. So he was an immigrant from Hungary, came over, really lived the American dream, started a small business, middle of nowhere, Pennsylvania, where I'm from, back when the steel industry was thriving, and, built a nice small company there, and making steel patterns. And one day he was up on top of something and lost his balance and fell, hit his head pretty badly, messed up his knee, and he was bedridden for about 2 years. And so it wasn't just the impact to him, it was the impact to our family too. Right? Immediately everything changed. My dad had to work on liquidating his shop. My mom had to become a caregiver to help my grandmother. And it just flipped everything 180 degrees. And I was 10 when that happened, 12 when he passed away. It's just something that sticks with you in the back of your head. And then fast forward a couple decades, I met a few other entrepreneurs who helped start Nymbl. And, it was just, this story happens to everybody. It wasn't just me. And as a young boy, I couldn't put that into context, but I'm extremely grateful for the opportunity to have that impact today.
Dr. Mirsky, can you share a bit from the clinical side on how Nymbl helps elderly patients stay independent and active through using the Nymbl technology?
Yeah, I think, just sort of building on what I was describing earlier, there are a lot of things that deteriorate as we age. And I'm of a certain age. I'm actually Medicare age myself. So, and I also watched, my parents decline in similar ways to what Ed described. And, not only do people start to lose their vision or the visual acuity as well as their hearing, but what I came to understand is that their balance reflex deteriorates as well. So if you take all of these things together, if you don't address all of them, if you don't address their vision and their hearing, which provide all of the environmental clues that they need, and then even if you did that and you allowed their balance reflex to deteriorate, folks would be, unwilling and really unable to, really venture around their homes and communities. So it was a real epiphany when I started to look at, the design of Nymbl and how it helps to retrain the balance reflex, and then, creates that stability and that mobility and helps people avoid falls. It was a truly compelling value proposition for me. And so what I tried to bring to Nymbl was the perspective of, if we could offer this to, entire populations of seniors particularly those in Medicare Advantage plans, we could have a tremendous impact on, the ability for individuals to age and thrive in place, and ultimately to avoid what seem to be inevitable falls.
Do both of you have any advice on like what people in their 30s or 40s or 50s or even 60s can do to slow this process and prevent falls like very, very proactively?
You want me to jump in, Ed, real quick?
Yeah, go for it, Bob. Yeah.
Yeah, look, we sort of peak depending on what skill or capability you're talking about, in our 20s and 30s and even 40s. But, unbeknownst to us, really, and we're unaware that we're starting to lose some of these capabilities, our hearing and our vision. And actually, balance is already deteriorating for people in their 40s and 50s. So I think there's a lot of value in helping people maintain their balance reflex. It's typically easier for younger people who are just more active and just more outgoing to kind of do what Nymbl does just throughout the course of the day and their and their lives. But over time, as we're older, I think people in their 50s and 60s don't recognize what's happening to them. They're just sort of in their homes more. They're less active. And we're not talking about people who are, running marathons and, hitting the gym every day, but your typical, individual in their 50s and 60s, this is like, it's almost invisible to them,
Mm-hmm.
which is why we kind of have been talking about this invisible epidemic.
Mm-hmm.
When it becomes visible, it's a catastrophic fall,
Yeah.
right? But leading up to that, there's all kinds of things that happen along the way that really aren't visible to the individual, their families, and their communities.
Yeah,
Ed?
Norm, my advice to people who want to improve their balance is to do Nymbl. But when I think about this, we talk a lot to older adults about why is walking not enough. A lot of older adults think, if I get up, if I walk for a mile, walk around the block, that's going to help my balance. Balance is as much about a reflex as it is about your leg strength and your mobility. And as Dr. Mirsky mentioned, as we get older, all of these things are declining, including the reflex. And so one of the keys to balance and the kind of the core tenet to Nymbl is we involve the brain and the body together. Yeah. And so when I think about advice for people, I think about ways that you can challenge your body and your brain at the same time. And that tends to keep that reflex, keep your brain sharp along with it.
Ed, have you found it challenging to get elderly people comfortable with using technology?
Great question. Surprisingly, no. I think when people look in from the outside on an elderly demographic, they think, well, these people don't know how to use technology. They'll never be able to use an app. COVID changed all that. Mm-hmm. When you look at tech penetration, which was on the rise, then all of a sudden everybody had to self-isolate. Everybody got, iPhones and iPads so you could FaceTime the grandkids and stay connected. There were telehealth visits. A majority of older adults in Medicare now, I believe, have experienced a telehealth visit. And so you have all these things happening that encourage tech adoption. We've really not seen that to be a barrier at all to older adults adopting this.
And Dr. Mirsky, what motivated you to join Nymbl?
Yeah, a colleague of mine from back in the health plan days had spoken to Nymbl and, had felt that a physician, particularly one who had not only practiced medicine in a holistic environment, but one who had been on the health plan side, working with seniors, could add value to Nymbl. Mm-hmm. And I would say in my first conversation, I found the whole thing very compelling. I had seen falls through the lens of claims and hospital census and, people being in the hospital with fractured hip or head trauma or what have you. It was enlightening to me to see the data show that, that's sort of at the tail end when people have had a catastrophic fall. But all along the way, they're falling, right? They're stumbling. They may or may not go to the doctor. They may or may not go to the ER. To try to identify those individuals early, and as we were describing, to start to intervene to avoid a second catastrophic fall. But why not avoid the first one? And so I found that to be incredibly compelling.
Yeah, and what is Nymbl doing to evolve by meeting the needs of elderly populations?
Yeah, I mean, there's a lot that we're an entirely personalized program for older adults. So
Huh.
between the combination of exercise and cognitive challenges, no two people have the same experience. And I think that's really important.
Yeah.
From the outside, older adults can look like a homogenous population. It's actually completely the opposite. They're the most heterogeneous population out there. When you look at life events that are happening, medical events that are happening, work, professional, all of the above. I mean, it's an extremely diverse population. So what we do is we have people come into Nymbl. Everybody has their reason for coming in. We start them with a risk assessment. We ask them what commitment they're willing to make. And then we design a customized program for them. And then we let them sort of go along on their journey and pick cognitive tasks and challenges that are suitable for them. So we both prescribe the journey from a physical perspective and also allow autonomy from the older adult on sort of the cognitive challenges. And in doing so, we're able to create that rich experience that's able to engage people over the long term.
And what do each of you see in the next 5 years for Nymbl?
You want to take that one first, and then I'll go?
Yeah, sure. I mean, we all know the population's aging. I mean,
Yeah.
I know that firsthand. But the growth in the population and then the aging of that population over time. If we can get kind of upstream here and help health plans, Medicare Advantage plans understand that this is not only something you deploy for people who have had a serious fall, you're trying to avoid another one, but that every senior, and even those who have not quite aged in, everyone in their 50s and 60-ish, are all starting to lose their balance reflex. And so I feel like the goal is really to help individuals and health plans and even providers who are risk-bearing primary care practices and so forth understand that this is really a population health program. And to Ed's point, when you're younger and sort of more active and have better balance, it requires less training to maintain your balance. And then when you're older and have lost more balance, it takes more effort to sort of stabilize that and even to reverse some of it. So it's really about opening people's minds to how dramatically we can really impact the entire senior population.
That's great. Ed, can you walk us through like what the typical member experience is? You mentioned it's, not a one size fits all approach. It's
Yeah, sure. So I
personalized.
think
What's pretty similar?
Yeah, absolutely. So members find out about Nymbl primarily through their health plans. A lot of what we do is sell through Medicare Advantage. We're getting into at-risk provider groups as well right now. But the member will receive some information about Nymbl. Could come in the mail, could come on email, could come on SMS. And part of what we try to do is provide content and education so that the older adults feel like this is a program designed for them that's giving them value first before they're prompted to sign up. Right. One of the challenges in this market is scam, 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 scam. And every older adult's on the lookout for a scam. So we try to provide value first, get them in the program. And then, as I said earlier, they start off with a risk assessment. We make sure what they're doing is going to be safe for them and appropriate for them. Both of those are important. And then the older adult basically gets to make their level of commitment. Some people do Nymbl every day. Some people do it once a week. Some people do it in between. But they're 10-minute daily sessions that older adults come in. They get a chance to work on their balance. We've added some bladder modules in there as well. There's some education around talking to your doctor, how to have successful physician visits. So it's not just balance training. As Dr. Mirsky mentioned, we have older adults with a variety of health needs. How can we help connect them with the information they need from a trusted source when they need it? And that's a lot of what we do. Core is balance training, but we surround it with a broader medical education that all older adults are looking for.
Yeah, and Ed, what was the strategy for really targeting Medicare Advantage as like your main market?
That's where the money is, man. No, it's we started off in senior living, and what we found there was that it was difficult to scale because the financial incentives weren't aligned. And we sort of banged our heads against the wall for a long time, and then we said, who's paying for this stuff? What's the payers? Right? And there wasn't an obvious CPT code for what we're doing. So, traditional Part B was out. We looked at Medicare Advantage and said, who wants to save money from reduced falls? And it turns out a lot of people raise their hands when that happens. So
that's great. Dr. Mirsky, how does Nymbl's solution affect a patient's emotional well-being?
Yeah, so as I mentioned, and as Ed did as well, everything is intertwined.
Yes.
And I can go on and on about why this is a great program for seniors. But, seniors and retirees, as they age, they start to lose their sense of purpose. We're not really a society that really values people as they grow older. And so, it tends to be like a sadly marginalized, group, and a growing group. So, it's really important to kind of meet them where they are and do some root cause analysis as to what it is that they're losing as they're growing older. And it's the connections with their family and their community. And part of that is, look, during the pandemic, people were, kind of in their homes a lot more.
Mm-hmm.
But before that, and certainly now, it's about people getting out into the world. And so, if among other things, one of the things that they are not confident in is being stable, is
Mm-hmm.
being mobile, and the fear of falling can be paralyzing for a lot of seniors. So, the solution we offer addresses all of that. And then that improves their sense of well being and improves their health outcomes. Because when you have social determinants of health and behavioral health issues, depression from isolation, and so forth, and you combine that with multiple medical chronic conditions, then you're in sort of this downward spiral. So it really is incumbent upon us to really embrace the senior and help them grow more confidence so that they can live fuller lives.
How have you both observed the vendor space changing over the last decade?
Yeah, I think, from my perspective, I think gone are the days of the PMPM that everybody gets that are guaranteed. I think it makes it challenging for digital health companies today because of the legacy of what came before, which were big promises, not a lot of outcomes, and plans stuck with large payments. So, what I'm seeing a lot of in the market now is going at risk for fees, guaranteeing ROIs, putting your money where your mouth is, especially in light of the CMS final ruling, which has tightened revenue a bit. Plans have to keep programs that deliver real ROI. So I'm seeing a complete change in payment structure, away from the guaranteed and towards the at-risk model. Of course, we love that at Nymbl because our outcomes are superior and we stand to benefit from that.
Can you walk us through some of the statistics?
Yeah, sure. So when we think about our model, we think about two things. We think about the adoption rate of Nymbl, and then we think about the amount of falls we're able to prevent. From an adoption rate perspective, we do about 5 times better than any other digital health focused older adult product. So we're able to engage older adults, capture their attention, and bring them to an experience that they love.
And what's your secret? How are you doing that?
Oh man, if I told you my secret, I don't know. No, it's about meeting older adults where they are. It's about treating them as people. It's about treating them as individual people. It's about saying, is this thing interesting to you? If so, click here. It's about saying, do you know why most falls happen at night? Do you know why walking isn't enough for a balance? Do you want the 10 top tips for improving your balance? Older adults are looking for that information, which isn't as readily available to them. And then the second aspect is, of course, we prevent falls. We did the world's largest fall prevention study with the country of New Zealand. Their single-payer health system is a customer of ours. We ran about 15,000 people through a year's worth of data and then followed them on to years 2 and 3. Found we prevent about 20% of injurious falls. Not just falls, as Dr. Mirsky said, sometimes people start falling, you fall, you skin your knee, that's fine, but we're talking about the bad ones, the ones that cause claims, that cause inpatient admissions, that are orthopedic events. And so with those two numbers, we're able to hang our hat on an actuarial model that Dr. Bob helped us develop and was instrumental in that, which has really pushed us forward in the market to the point where we can say, yeah, we can guarantee this outcome for you, and we're willing to put our fees at risk for it, which is unique in the fall prevention space.
Was part of the reason they were able to prevent falls is because a lot of the New Zealand population grew up playing rugby?
I'm sure it contributed.
Okay. Yeah, you always got to see, is there other advantages to certain locations? I think that sport, you got to, always be balanced. Otherwise, you're probably not going to have a very successful career. Dr. Mirsky, what's a not so obvious common misconception people have about treating older adult populations as opposed to, general populations?
Yeah, I think as we were saying earlier, seniors tend to have a confluence of medical conditions, chronic medical conditions that, when they were younger, were sort of isolated in terms of their impact on their lives. But as you have things like diabetes and hypertension and, all these other things, they start to express themselves really in medical events like
Mhm.
heart attacks and strokes and things like that. And also, I think we've come to realize again that when you're dealing with multiple chronic medical conditions, even if you didn't have a behavioral health situation prior to that, you will now. And also, not every senior has the resources to live their lives fully. And so you
Mhm.
have a lot of seniors who are pensioners and are on limited budgets and so forth. And so I think, again, what I came to realize, not only through being a family physician, but then in my health plan experiences, you can't just focus on medical problems and, having clinical medical programs. As we've been saying, you have to look at that whole person. And if you can help solve for not only their medical conditions, but their behavioral health and social determinants of health issues, and see them, holistically and as unique individuals, I think you can have a much greater impact on their lives. When we're younger, it's easier to be resilient, right?
Mhm.
But as we age, it's more difficult to be resilient. And so, you know, that's what we're up to, is helping seniors be more resilient, which is why I called my consulting company, by that name, because it's so important for people to, understand what they're up against, reach out for support, receive support, and live those, fuller and healthier lives that they spent their whole lives kind of waiting for. Right? And so I
Mhm.
think that's what we're up to.
Ed, since founding the company, what are some of the biggest challenges that you've overcome?
Yeah, I think, sort of piggybacking on what I said earlier, the level of evidence required to really get into health plans has just increased based on
Mhm.
kind of a bill of goods that was sold previously by other companies that didn't pan out. And so I think
Mhm.
one of the challenges is just the time it takes, right? And the capital that you need to be able to come in here and say, okay, let's create a prototype. Let's take it out. Let's test it with some people. Now let's take it to a clinical setting. Now let's do some sort of at least proof of concept study that we can
Mhm.
publish, or some data that we can get. And until you really have that data, it's really tough to get the attention of a health plan. And so I think that's been our biggest struggle, is just, the world moves more slowly than we want it to. We've got a big innovation here that can help a lot of people. We wish we could put it in everybody's hands today, but that's not the way the world works.
And what are the successes you're most proud of since founding the company?
Yeah, it's every single fall that we've prevented, right? You think about people like my grandfather. I'm looking out here at the folks working in the office, and every single one of them has a similar story. So,
Mhm.
when we've demonstrated that we can prevent falls, that's really impactful, because you're saving lives, and you're helping families avoid what mine had to go through, which was just completely changing everybody's roles and responsibilities around an injurious fall.
Yep. Dr. Bob, can you walk us through, how Nymbl reduces healthcare costs? It's like if someone, doesn't break a hip, then they don't need to have surgery and rehab and all the other things. But like any other things that some viewers and listeners wouldn't think of that you guys have, like some downstream cost savings.
Yeah, yeah. Look, it's not only the downstream cost; it's also the upstream cost,
Mhm.
right? So what we find is that in leading up to a fall, even before people are having an injurious fall, they start to live more constrained lives. They
Mhm.
may not even get to their physician, right? So they can do a video visit, but
Mhm.
sometimes you need to go to the doctor and get examined. And so, the outcomes that seniors have are much worse even before they have a fall. And so there's
Yeah.
lots of consequences to not having care for chronic conditions and so forth, right? As well as sort of living these constrained lives and everything that occurs from that point on. And then you have, what we're trying to really prevent, which was what Ed was saying, is that really serious catastrophic fall.
Mhm.
And it's at that point that people go to the ER, they get admitted to the hospital. But so many of those folks don't go home.
Mhm.
They go to a skilled facility for rehab. And from there, their health continues to deteriorate. And many of them end up in a nursing home or some other sort of assisted living sort of setting. And
Yeah.
that's just sort of the beginning of the end of their quality of life, but also the cost of care when you don't get home, when you don't stay home, and then when you get admitted and you don't get home, the cost of care, sort of in that barbell is much, much worse. And there are other economic levers for health plans. It's one of the things I try to bring to Nymbl is having sat on the other side of the table from vendors who are pitching programs, as Ed was saying, that don't have any proven results and don't have any impact.
Mhm.
Health plans want to make sure that the program is going to be impactful, that is going to do what it says it's going to do, and also that offering it helps them to differentiate themselves.
Yeah.
And and folks tend to stay with a plan where they're getting a program that isn't available through their competitors. So there are a lot of economic levers for the health plans.
It's fantastic. Ed, can you walk us through how you identify a patient's current and future risk levels?
Yeah, sure. So we've spent a lot of time developing this actuarial model that I mentioned that Dr. Bob has pioneered with us. There's two things we can do. Number one, we can ask the user. We can put them through a standardized risk
Mhm.
screening, and we do that. And those are questions like, you're on 4 or more medications. Do you have to rush to the bathroom at night? Are you worried about falling? Which is a huge predictor of falling, whether
Yeah.
somebody's worried, because it speaks to what Dr. Bob said. They're shrinking their lives. So we do that. The other thing that we do is we can look at claims data from a
Mhm.
health plan, and we can stratify people into multiple risk categories. And we can actually get quite granular here. Obvious are the people with an orthopedic event that's obviously an injurious fall. Maybe
Mhm.
a little less obvious are the folks who, have a claim for a sprained wrist and a sprained knee, something like that suggests there might be something going on here, but it's not directly coded as a fall, which is one of the
Mhm.
challenges here, because coding for falls doesn't pay as well as other things, and get into the medical coding mess here. And so by combining those two things, if we have a claims history of a member and we ask them, kind of put them through a risk assessment, we're able to pretty well
Mhm.
stratify them into which bucket they're in, and then deliver the right intervention at the right time.
Very, very nice. Ed, what advice would you give a founder before they start a healthcare business?
Oh, great question. I got this piece of advice once from a friend of mine, which is there's a zillion problems out there. There's no shortage of problems.
Yeah.
What there is a shortage of is a deep understanding of that problem.
Mhm.
And so his advice to me, when he was looking for his next company, he ended up starting a sort of a behavioral health company around happiness. He
Mhm.
actually, went over to Tibet and lived with monks for a year and
Mhm.
studied how they meditate. And so he built this meditation business because all of a sudden, he knew that better than anybody in the world. And I think the same about healthcare. Find a problem you're passionate about, then embed yourself in that situation. When we
Mhm.
started Nymbl, I was shadowing in the ED. I was going to senior living communities, talking to members. You're not going to get paid for it,
Mhm.
but that knowledge is just invaluable, because when you're embedded in there, you hear people will bring their problems to you. They'll tell you what's wrong, and you'll see firsthand what that looks like. Medical workflow is very challenging. You
Mhm.
can't just assume, I've got a new solution, Dr. Bob, put it in your workflow. Every patient visit,
Mhm.
I want you to spend 5 minutes with them doing this. Well, good luck with that, right? And so really getting deep into something and taking that time up front, even though it's unpaid, to really understand the problem, I think pays off a lot later.
Dr. Mirsky, what advice would you give clinicians that are thinking about, becoming a healthcare executive?
Yeah, I think being a physician is a calling. And I
Mhm.
think then being effective on a larger stage, is a whole other level of, of
Mhm.
competence and ability, in my opinion. Maybe that's, a little self-serving of me. But I would say now in my post health plan career, what I've been looking at is which companies do I want to spend my time working with? So it's sort of the flip side of the coin that you were asking Ed.
Mhm.
Why is he doing this? Well, for me, there are lots of opportunities to work with, vendor solutions and so forth. I try to pick the ones, again, that I think are going to be impactful, that are solving for something that
Yeah.
is, truly important, and that the solution really works, and that the company has a high likelihood of being successful, right? That's what really drew me to Nymbl and has me sitting here, partnering with Nymbl. The other piece, the final piece is, do I love working with the people? Right? Is everybody passionate? Is everybody, sort of joyous in the mission that they're on? And so that's the final piece. And for me, all of those things need to be in place in order, for me to feel like that's a company that I think, is going to be a good fit. And that's the same advice I'd give to any physician who, wants to go to, to the next phase of their journey, whether it's on the health plan side or it's working with vendor solutions. As Ed was saying, find something you're passionate about that resonates with you, and jump in.
Great advice. Ed, what do you think the most crucial traits a founder must have to be successful?
Oh, perseverance for sure. I mean, it is tough, and it gets pretty lonely too. And there's days when you have to make really hard decisions, and there's no one to make that decision for you. At the end of the day, it stops with you, and that can be pretty heavy. And if you don't have that drive and that true commitment to the mission and the ability to persevere through anything, it's going to be a short ride.
Okay. I ask everyone who comes on this podcast, like, how do we practice what we preach? We talk healthcare, our livelihoods are in healthcare. That's what we do 9 to 5, Monday through Friday. What are we doing in our personal lives, to kind of be good examples to our colleagues, our friends, our family, so on and so forth? How do you participate in wellness? Each of you, like favorite ways to exercise, favorite ways to reduce stress in 2 very stressful jobs.
Yeah, I'll take this first. Every morning, 6:15, I've got my little Peloton group that I ride with.
Nice.
And I need that. Otherwise, I drive myself crazy with the amount of energy that I have. So, I think that exercise is really helpful. The other thing I've started doing is just to try to be a little bit more mindful of what my body's telling me. And do I need to get out of the office and just take a walk? Even if it's just 15 minutes, I walk around the block. Sometimes you come back feeling 100 times better. You're able to process something you've been thinking about, and you're ready to go again. So I think, not stacking yourself up. It's a long game. These startup rides aren't over in 6 months. It's 6 years. And so gearing yourself up for the ability to make it through there by not burning yourself out, I think is critical.
How about you, Dr. Mirsky?
Yeah, I listen, Ed, I can personally attest that it's a long run, and that's good news, right? Getting to be of a certain age is really a blessing. And some of it is genetics, but a lot of it is how we treat ourselves. And listen, I saw enough physicians who didn't take care of themselves. They were not good role models for their patients or for the community at large. And so, I don't know that I do it because of that, but taking care of my mind, body, and spirit are absolutely critical. At various points in my life, I've been a runner, I've been a cyclist. Now I'm walking, I'm hiking, I'm bicycling, I'm trying to stay active. I'm very mindful of my diet, trying to, eat healthy, stay as plant forward as I possibly can for lots of reasons, but health, very much among those. And to take time out for mindfulness, whether it's on those walks or whether it is taking some time out in the middle of a busy day and just getting centered and focused. And I think that not only helps my health and well-being, but it also helps me be a better father, helps me be a better friend, better colleague. So not everybody learns those lessons in their lives, but I hope I have.
That's great. And, I think what you mentioned is being healthy. Obviously, it's getting exercise and being mobile and being outside and active. Also, what you're putting in your body. I think the hardest thing about like eating healthy these days is not all health foods, or at least foods marketed as health foods are. So it can be very confusing. So are there any homemade things you make at home, maybe a full meal or just like one dish that you really enjoy helps you stay on track, and it might give someone else the inspiration to try something new?
Yeah, look, it's about the food we eat should look as much like the ingredient that it comes from. And
Hmm.
so it doesn't have to be all that complicated. It can be whole grains and legumes and vegetables, and just make it flavorful. And your palate changes,
Hmm.
and you start to really enjoy the tastes and flavors and textures of whole foods. And it gets easier and easier.
What about you, Ed?
Yeah, I
Any
think I
advice?
think Bob's got the right approach there. I think one of the fun things about food is there's a lot of new things out there to try, and so I think that that's kind of a fun opportunity to introduce something new. I think I try to think a lot on the macro side of just how am I balancing protein and fat and
Hmm.
carbs, and how does that all fit together? Do I get it right every time? No. Sometimes after work I just want to come home and have a couple Doritos, but there's ways to manage that too. But I think it's. I think Dr. Bob was right. This is mind, body, and spirit, and
Hmm.
what you put in really matters. And I'll find myself, at times if I'm busy and I miss breakfast, and then you're at lunchtime, you haven't eaten anything all day, you wonder why you feel bad. So
Yeah.
being deliberate, being mindful about all these things, I think is extremely important.
Well, we really appreciate you joining us on the Digital Health Heavyweights podcast. Really excited about what Nymbl's doing. Really appreciate you both, coming on to the show. So Ed, CEO of Nymbl, Dr. Mirsky, CMO of Nymbl, thanks for joining us, and we'll be tracking your progress and your success.
Thanks for having us.
Thanks so much.
All right, thank you. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.